All fluffy for the rain.
You're great. Welcome, everybody. I'm Dr. Sage Wolfe with the Detox, BraveHeart Nation, and this is my lovely practitioner,
Romy Burkhart. How are you?
Wonderful. And today we're just going to be kind of going over what Wolfe Non-Surgical and what I'm doing out here is, and then like kind of lymphatic drainage, a little bit of tips and stuff for that. And then also, we had a lot of questions last time on what is like Gouache Stones, so we are going to show you what that is. So right now I'm out here in the Prosper area, Texas, and I'm doing some training with Romy and some other practitioners, and then I'm also doing just like a lot of non-surgical on clients in the area. So like if you're interested, there's only a couple availabilities left. But we're out in Prosper, Texas, so I've been dealing with everybody from ages so far 17 to 75. And we've had ailments just within the past 3 days from tennis elbow and like kind of like a little bit of numbing sensations coming to the fingers, a little bit of kind of carpal tunnel almost, a little bit of neuropathy happening. Today I had some low back and some abdominal issues. So, and I've had another girl who has major headaches all the time. And the thing is, guys, it's so funny because I've only probably since I've been here within the past 3 days seen about 20 clients, which is a good amount, but in all those clients, you can see the people who are like wanting to heal immediately, and you can see the people who kind of are holding on to that ailment. They just don't want to let it go. And like Romy's starting to see that a lot too, and she's realizing it as I'm talking, and she's like, wow, like that person like constantly reiterates their illness. They constantly reiterate how crappy they're feeling, how bad their symptoms are, and there's no time to stay in the present moment. And I get it, like the symptoms can be severe, they can be really debilitating and annoying, but like, are you doing everything you can? Or are you really just kind of feeding that thought of that toxic thought of where that ailment is coming from and being like, I just can't sleep, I'm so irritated, I'm in such pain, like my hip just constantly hurts. Like, are you stretching? Are you doing mobility exercises? Are you making sure you're hydrating properly? Are you really eating a perfect day diet? Are you doing the clapping? Are you going out and getting some form of therapy maybe to stimulate that area? We can't buffer down the pain that's telling us. Pain is our GPS. I say it all the time. We can't buffer down that pain for so long and expect not something large to kind of be the tipping point to being like, wow, no, this is so debilitating. And then I use the analogy all the time. People work their whole entire lives, and then when they retire, they spend what they made to keep them alive, And like, there's no benefit in that, because like, why don't you constantly know that your body, you only get one of these, that we got to be mindful about what we're putting in on a daily basis from the time we are an infant. And even like, it would be lovely if our moms, when we were a baby, were mindful enough to take the right nutrients in, to give us the right nutrients when I was breastfeeding, so then I wasn't coming up with already getting a lot of dairy and sugar and within that actual milk, because then it's toxic now. And it's like, why is my daughter's child, why does she have such constipation issues and she's only 3 months old? Why is she so congested all the time? Why is she getting sick? It's like, what is the mom still putting into her body? Just because the baby came out doesn't mean the job is done. And so, but we're out here doing a lot of non-surgical on clients, working on their ailments. And as I was saying, you see some people turn around, so they're like, wow, this is so amazing. I'm feeling such relief already right after the treatment. And then some people were like, I feel relief, and then it starts coming back immediately after, because they're like, I just want to be able to be better. And it's like, why? You're taking action now, so you should feel proud of yourself. And there is no proudness right now. You're still like that broken bird. And so it's like, no, you're taking the action. You're doing the right steps. You just got to continue. We did a lifetime of poison. We should do at least a year or so of being mindful of what we put into our bodies. And so I'm out here doing a lot of non-surgical. Romy's learning a lot. She's doing some non-surgical on me because I'm critiquing my practitioner's techniques, seeing where we kind of just need to sharpen our edges. And other than that, that's kind of what non-surgical entails, and that deals with any ailment from A to Z, from carpal tunnel syndrome, scoliosis, fibromyalgia, hysterectomy, shoulder replacement, knee replacement, ankle issues. It doesn't matter. We go in and we pull that scar tissue crystallization and calcification apart that cause that bound tissue because our bodies are too acidic, and then we kind of get your mind right, so we start eating, thinking, and drinking right. So what I want to talk about is right now is the clapper as well, because we talked about the clapper. We want to go into lymph, you guys. So stimulating our lymph, we have lymph areas, and if you don't have a clapper, you can use your hands. Your hands get a little tired though after a while, but either way, using your hands is great because it's like double the stimulation. I'm stimulating my hand and the area I'm clapping. So our lymph areas are going to be the neck, pretty much from right under the neck down through to my clavicle areas and into my chest, and it stops right about here. You have little lymph nodes everywhere, but this is where a main lymph drainage point is. Then we got under our armpits, both armpits, always on both sides. Then we got in between the elbows. We have our groin on the sides of our hip flexors, those corners of the groin. We have behind the knees, and then we have around the ankles. When you're clapping and you really want to do like a really good lymph drainage for your body, you're going to do 5 minutes on each of those areas. With the neck and chest, I want at least 10 to 15 because it's a little bit bigger of an area. But hitting the smaller areas, I want 5 minutes each there to really get a lymph flush going. 3 main ways to get the lymph going. That's going to be sweating, peeing, and pooing. And so if your bowels aren't moving properly, the lymph's going to be slow. If you're not peeing well, your lymph's going to slow down. And if you're not sweating at all, so you're not doing some form of activity, your lymph's not moving at all. And people are always like, my lymph's moving. The heart's a pump. The heart is not a pump, but what else can help the lymph? The lungs are a pump to get blood flow to the heart, and the heart is a valve. And so if I get crazy into my breath work and I really do some good deep breathing. As soon as I hit my climax when I'm inhaling, I do another burst to really oxygenate my body. As I'm exhaling, while I exhale, I really exhale and push at the end just to get as much carbon dioxide out as possible. And then we're going to re-oxygenate that body. But when I'm using my lungs like that and I'm causing them to pump, I'm causing more blood flow to move down to my heart for my heart's valve to start moving the blood flow throughout my body, which entails is going to help the lymph. So breath work, super important for the lymph, but it isn't what actually flushes the lymph. But get those lungs working, make sure you're staying in that breath and really breathing. And so clapping, getting that lymph going, getting on a rebounder, if you have a rebounder at home. If not, if you have like a cycle, a stationary cycle or an elliptical, like that's going to get you going. Don't just walk by it. I'm going to say 20% of you on here have one in your house. You walk by that thing every day. 5 minutes is not hard to care for yourself. So take the time. What is important to you? And like my health is. And so I want to spend at least an hour a day focusing on me, because that's going to be what carries me through life, to have the energy, to make the money, to have the fun, to go out and enjoy. Lots of stuff is going to be important with that. But so lymph, guys, make sure your bowels are moving. So daily cleansing, tea, making sure you're eating some good fibrous foods, not eating too much gluten and dairy to clog you up. Hydrating like crazy, making sure the body's hydrated properly, because you don't want to be sweating too much at the gym, and if you're not hydrated, because then you're burning out your adrenal glands. So it's just things to be mindful of. Other than doing that, then we're going to want to make sure we're peeing properly. So make sure, once again, you're hydrated. And then the clapper going to come into play. Amazing for getting that lymph going. And then Gouache Stones. How do you spell Gouache? It's G-U-A-S-H-A. I'm almost certain. And if you just type in Gouache Stone, like a rock, it'll pop up online for you. If you live in a decent sized city, you can go to any kind of cute rock shops, or you kind of know where to get them. What's another place that you could buy that?
You can go to a cosmetic store.
Like a cosmetic store.
Yeah.
A lot of them have rose rollers, and they'll have different types of Gouache stones.
Yeah.
And so this is kind of what one looks like. We'll hold it up a little closer. This is a nice rose quartz one, shaped up like a heart, kind of cute. And so we are going to be working with a Gouache stone. And so with a Gouache stone, as I was talking about, it's like one-shot therapy, guys. When I showed you guys how to do the shot glass on you and break up scar tissue that way, You can do the exact same thing with a Gouache Stone. But if you don't have a Gouache Stone, you can use the shot glasses. But these are good for the lymph drainage as well. But she's going to show you a little bit, because Romy had a surgery on her tooth because it was she had pretty much an abscess on one of her teeth, got really bad. She was going to go septic. They had to do a bunch of draining. And so now she has a little bit from where they stitched her up, a little bit of pull right under here. It's very minimal, but you can see it a bit. And so what she needs to be doing is constantly working in, and it's not a scrub. We don't want to scrub back and forth. She wants to be pushing one direction, and then she wants to flip it around and pull the other direction. Really kind of, you're going to feel bands and strands snapping underneath that area. And she can open up her mandible. She can come on top of her maxilla a little bit if there was scarring up here on her lip. If you have sinus issues, you're going to want to get into the sinuses, and that's going to be around like the nasal bone over here. But you're even going to want to come up into the lacrimal bones and the glabella area right in here, because if you open that up, that's going to be getting a full sinus clearance. You can work around your ocular bones, and you're working the actual like crow's feet, because when we smile a lot, or as gravity pulls down, we start to get these little wrinkles here. You're going to be pulling one direction and pushing the other, and she feels these little crystals. Just don't drag far, because we don't want to cause skin abrasion. We want to do little bits at a time to where you feel those crystals snapping and popping. And so the Gouache Stone can be used on any hard area that you can touch. So like your hands, your elbow, your face. It's going to be good even for getting into the occiput. Like if I had a headache, you're really coming off that occipital ledge, and then you're scooping into that occipital ledge. And you can do the top of your skull if you have scarring on your heads from just an injury or a traumatic experience. You can get into the knees and the ankles really, really well. Other than that, when it comes down to non-surgical work, you're going to want to hit it with like, you want to do non-surgical like with an elbow in like low back, spine, hips, areas that like need more precision. We got to get like one of our certified practitioners in there. And so that's going to be really amazing. And like just for like getting the lymph going as well. Like if I had a Gouache Stone and I was breaking up scar tissue along here, I'm going to take it, and you can see like this has a nice curvature here, but there's totally different kinds online. You'll see some come in sets. So you'll mess around, and like I'll take it along the down on the neck, because I have elongated muscles. My skin's a little smoother, and I'm not trying to break up stuff. Just to get my lymph going, I can drag it up and down my scalenes, and even come back into those sternocleidomastoids. And then you're going to do that. You can work into the chest with it, like if you wanted, because they have nice smooth, they're stone and they're polished. So they have smooth tops that you can kind of work through and really open up. But if you don't want to do that and you have more of a calcification and it's a hardened area, you're going to want to use a shot glass to kind of really break it down. So once again, the Gouache Stones, fantastic. Doing things like, guys, don't drink cold water. Yes, iced water on a hot day, great. But once again, let's get that lymphatic system going. It's really hard to get, like, think about it. You have egg yolk or dried ketchup on a plate. Go try to wash that off with cold water and soap. It's going to take you a while, and you're going to have all these speckles and stuff everywhere. That's actually what happens inside your esophagus and your stomach and your small intestine and your large intestine. Things get stuck. We don't chew properly. We eat things that are not so good and have chemicals in it that don't allow our bodies to break it down properly, and it gets stuck in pockets and on the lining of our peritoneal and throughout our like whole abdominal cavity. And so drink, you don't have to have it scalding hot, because I don't like hot water. But I at least try to drink it warm or room temperature, because internally, if you think about it, you're 37 degrees Celsius inside, you guys. So if you're drinking really cold water, your body has to literally work hard to warm it up to even try to digest it then. So be mindful about the kind of water you're drinking, what kind of water is it, and the temperature. Don't go for that ice water. Try to do room temperature to nice and warm, because we want to get that plaque off. Other than that, it's a pleasure. You're going to see me and Romy hopping on here over the next few days. She's going to be teaching me how to make her great special protein smoothies, because I go to the gym quite often, so I get kind of stuck in my same regimen, and I'm okay with the kind of vegetables, rice, chicken, vegetables, smoothie, plain, same, all the time. So she's gonna kind of go over some of her recipes and what is really great. And so be on over the next couple days to see what's gonna be coming for the food recipes coming out, because I'm excited. Thanks for joining, everybody, and learning a little bit about like lymph drainage with Gouache Stones. And if you're interested in non-surgical, go to Detox World Training and Healing and follow us around, and you might be able to catch us in catch a training or catch a treatment if you'd like, depending on what's going on. Once again, guys, thanks for joining, and I hope everybody has a beautiful afternoon.
Bye, guys.